There it goes.
Well, hi everyone. It's February 20th, 2020, and I've been asked repeatedly on my Facebook page and other places to talk briefly about neural therapy. So I'd like to do that using this model. And there is a really wonderful book that you can get. Let me see if I can get it here. I can. It's called, you can see the book's cracked. I've used this a lot. I've read it cover to cover and it changed my practice. Manual of Neural Therapy according to Huneke. And get a close up. Good. And you can get this online. And Huneke's were Germans who discovered, probably around 100 years ago, brothers who discovered that a disturbance in the body can cause not only a local effect, but a distant effect. And the book talks about scars in particular, injuries, trauma that is retained by the body. It talks about teeth. And all of you know that I'm very much into dental issues. You walk into this office, I want to know what your dental history is, where your root canals are, where your missing teeth are, etc. And I figured I'd use this model to explain some things to you. You can see on this model lines. Now, these are acupuncture lines. These are acupuncture meridians. And the meridians go down the leg, you can see here. And I'm not going to explain each meridian, but there's a heart meridian, there's a gallbladder meridian, spleen, stomach, etc. One of the theories is that when you have a scar, the surgical or trauma, the wound is remembered by the nervous system. The scar cut across nerves, and the nerves never properly healed, and they continue to weep. And that sort of throws your autonomic nervous system on tilt, like the old pinball machines. And it's on tilt. And a woman I just did that I posted, she had a scar here from a pelvic scar, OBGYN surgery. It cuts across meridians, and if the nerves in there are weeping, it sets off what we call, from this book, an interference field, and that sends abnormal currents to the nervous system, the unconscious nervous system, called the sympathetic nervous system, and that can reflex out anywhere that it wants to and cause a distant problem. The treatment for this generally is something really simple. Just treat the scar. They found that an injection, they like Procaine, and I do too, not lidocaine, I like Procaine. That an injection, let's say that scar here, you just inject superficially into the scar itself, not deeper than the scar, into the scar, and that seals the nerves and resets it, and boom, you're off of tilt. Things just begin flowing immediately. And that happened in the case that I just posted on the 18th or the 19th. She just felt like this. Her whole body was contracting. I treated a scar here. Everything opened up, and she came back today, 2 days later, saying her fibromyalgia for 14 years is essentially totally gone. I have seen scars anywhere on the body affect all kinds of places, almost anywhere on the body. What about teeth? The teeth in German acupuncture are connected to acupuncture meridians. And we can see that in this chart up here. Okay. And each tooth, come on back. Each tooth connected to an acupuncture meridian, if the tooth is damaged, if it's infected, if there's a root canal, can put a disturbance out. Now, it generally, in my experience, will affect what flows along that meridian path. Let's say it's the large intestine, for example. Well, the large intestine comes down the arm here, and you might get tennis elbow or something else along this path, and the large intestine also affects certain points back here in the back, and we'll often find pain in the L4-5 area from a disturbance in the large intestine meridian. The front teeth are connected to the kidney meridian, and the kidney meridian comes down the front and down the inside of the leg all the way to the foot, and the front teeth are connected to the bladder meridian as well, and the bladder meridian controls all these central meridians along the back. So I like to know, and I track down with muscle testing where a disturbance is. And in my hands, the way I do it, and other people might do it differently, I just touch the scar, or in the case of a tooth, the patient puts his finger in his mouth and touches the tooth or the empty socket where the tooth was pulled, which could still have a lingering infection called a cavitation. And then the nervous system recognizes it. The patient might not, because he's been living with it, but the nervous system recognizes the attention drawn to it, and then the indicator muscle gets weak, and I know that there could be a problem. If a scar tests positive, I treat it with Procaine. If a dental issue tests positive, then I also treat it with Procaine and see if the distant problem goes away. If it goes away or gets significantly better, then I refer them out to a dentist, a biological dentist. In the case of Dr. Sen, my friend, he tells me that I'm about 90% accurate when I get this. No one's 100%, I'm not, but I'm happy with 90%. So that's the theory behind neural therapy. There's people walking around with years and years of pain, disturbance, dysfunction, and disease that could possibly be treated in just a couple minutes with literally a local anesthetic costing pennies. You won't get treated for pennies because you got to pay for the office. But think about it, the material itself is very inexpensive compared to what drugs could be, and drugs tear you alive and they don't address the problem. Neural therapy addresses the problem. There's more technical injections than what I just said. There's certain nerves that can be injected, ganglions, etc. But this is the basics that covers about 85 to 90% of it all. So I hope you got something out of it and gives you some more idea of what I do and why I do. Thank you for being here.